I think overall the progress is slow. Depends on the individual again. One of the things I like to talk about is with TBI, I think success is measured sometimes in inches rather than feet. I mean, just having a good day sometimes was a pretty good outcome for that individual. On the other hand, other individuals who are more cognizant of the issues, it kind of is an ebb and flow, but what you're looking for is the angle or the regression line to continue move up to gradual improvement and continued improvement. There's going to be fluctuations up and down, but as long as we have a continual movement up, I think is very successful. Autonomy, I think, is very, very important in the sense of allowing the individual to be a part of the treatment team themselves. And a lot of times any program, ours is, I think, is similar to everyone else's in the fact that sometimes we don't grant that from day to day. I spoke to that recently at a conference regarding the day-to-day autonomy and expression and the individual's capacity to express themselves. And unfortunately, sometimes the model is that they don't know what's best because they have a brain injury, and we know what's best because we're the professionals. When in fact, that could be argued from moment to moment and situation to situation. If someone's in an aggressive acting out behavior, then they're probably not cognizant nor have the capacity to make a decision in relation to their treatment. On the other hand, if you can de-escalate them from that behavior and speak to them and offer them alternatives and present the information in a way, I usually talk in terms of analogy, trying to say the same thing over and over again in different ways until you see the light in the individual's eyes come on and they begin to get what you're talking about. So what I'm saying is, in the expression of autonomy, it's important for us to say things in different ways as professionals and not just stick to our old model of this is our treatment program, this will work for you, trust and believe us, we're the professionals. One example the other day when I watched a nurse was giving a medication and the patient refused their medication. And so the nurse attempted to tell the patient, it's time for your medication, it's 9 o'clock, that's prescribed time, let's take it. And the patient refused and adamantly refused, and it created kind of a verbal outburst, and then the patient stomped away angry and didn't receive their medication. You think about that logistically and you think, okay, well, I understand that it was supposed to be given at 9 o'clock, but is there going to be a problem giving it at 10 o'clock or 9:30? And go back and try, and again, not get stuck in that rigid viewpoint of the time of medication administration. And ironically, that will work. Because if the person's been overwhelmed and frustrated via that interaction, and you give them time to calm down, then come back and approach it in a different way and say, you know, for example, now that I see you're calmed down, what are your thoughts about medication for you today? As opposed to, it's time for your medication here.